Good afternoon, everyone, and welcome to today's webinar for Diabetes Month. Without further ado, here is Kate and Jacob presenting about diabetes supports for this month.
Thanks, Leanna. Hi, my name is Kate Rugg. I'm the Director of Nutrition Services and Project Management at the St. Louis ARC.
Hi, my name is Jacob Pearson. I am a Master Social Work student and practicum intern at St. Louis ARC, and I'm also a type 1 diabetic.
So today we are going to be discussing diabetes, a little bit about what diabetes is, as well as what it's like to live with and manage your diabetes. And Jacob's going to do that portion of our presentation. Like Leanna mentioned, it is Diabetes Awareness Month. And so we just wanted to highlight sort of the information and provide you guys with some education. So just as a disclaimer to start, this presentation is for educational purposes. It's not personal medical advice, and it shouldn't be used for diagnosis or treatment of a healthcare condition. Of course, you should always consult a medical professional who would be your doctor in this case, if you have any concerns after listening to our presentation. Like I said, my name's Kate Rugg. I'm a registered dietitian, which basically means that I went through school to kind of understand the relationship between food and nutrition and chronic illness and diseases. That education helps me work with people who may have diabetes, whether that's type 1 or type 2. And so I'm going to use this time to kind of talk through what those different variations are, discuss some risk factors, and also how it impacts folks with intellectual and developmental disabilities.
Yeah, and then again, my name is Jacob. I'm going to talk about how I have coped with diabetes and how people I know have coped, kind of how it affects your mental health. Different ways people go about diabetes management, and Kate will touch on that a little bit as well. And then talk about resources and technology for living with diabetes.
So just to kind of give you a basic overview of what diabetes is. So it is actually a group of metabolic diseases, and it's defined by high blood sugar, or what people might call hyperglycemia. High blood sugar just basically means that when our body goes to digest our food, specifically foods like bread, cereal, pastas, even some fruits or sugar, like in cookies, candies, that kind of thing. When our body goes to digest that, it has a harder time using the body's hormones to get those that sugar out of the blood and into the muscles, and to be able to use it. So, blood sugar can be monitored at home or by your physician, and usually you do both. And with your physician, they're going to be using a lab, which we call hemoglobin A1C, and that's basically examining what your blood sugar control looks like over around a 3-month period of time. So typically, an A1C of greater than 6.5 would result in a diagnosis of diabetes. So type 1 diabetes is basically it's an autoimmune disease that damages insulin producing cells in our pancreas, which is one of the organs in our body. And it requires insulin injections in order to monitor our blood sugar. Type 1 diabetes, typically folks think of it as juvenile diabetes, and it's usually diagnosed early in a person's life before they reach adulthood. Type 2 diabetes basically results in a deficiency of insulin or a decreased effect of insulin on our blood sugar. So I feel like I'm sort of talking about insulin quite a bit, and I like to usually define that or take a moment to, just in case you guys may not be familiar. So we've talked about blood sugar, but insulin is something that, again, our pancreas produces. When we think about insulin, we normally talk about it like it's a key. So when we have sugar in our bloodstream, it's kind of traveling around looking for its place to go. And insulin is the hormone that our body produces to open up little ports between our bloodstream and our muscle tissue or our cells, where then that sugar can go in and help our body make energy. Insulin, like I said, in both type 1 and type 2 diabetes, you get some impact on insulin's effect. In type 1, usually insulin is not really produced very well anymore, and therefore we're going to have to get it from the exterior of our body via insulin injections. Versus type 2, usually we see what's called insulin basically we start losing sensitivity to insulin. So even though our body might be making it, our body's not able to use it as well. And then some folks with type 2 diabetes may eventually have to use insulin injections as well, but everybody's a bit different. So in terms of risk factors for type 2 diabetes, and I also include a little bit about type 1 because it can have sort of some familial relationship, but again, it's an autoimmune disease, so it's really going to be kind of dependent on the person and the way your genetic makeup is. Age is listed because typically, again, you're going to see that before you reach adulthood. Type 2 age, we typically see an increased risk for diabetes starting around the age of 45. However, younger people can be diagnosed with type 2 diabetes. A family history is also a strong risk factor when it comes to type 2. And then as well as physical activity and body composition. I say that because you might read information where it says, someone who's overweight is an increased risk for diabetes. And that may be true, but again, the BMI, which is the body mass index, has been shown to not always be the most effective for kind of giving someone's overall body composition. So typically we really see the risk increase for individuals with higher weight status when their fat distribution tends to be more in the middle. And that just has to then do with, again, how our body, we get a little bit more insulin resistance when that occurs, as well as a little bit more cortisol. Another component when I say cortisol, that's really talking about kind of a stress management hormone that our body has. It reacts in a lot of different ways, but it does play a role in sort of modulating insulin resistance. And then the final risk factor for type 2 is whether you've had a history of prediabetes or an individual who's had what's called gestational diabetes. So when an individual is carrying a child, some individuals can develop diabetes while they're pregnant, and then that can result in diabetes for the time that they're pregnant, versus once they give birth to that child, you may see that diabetes condition subside, but it may increase the risk for type 2 later on in life. Finally, I wanted to discuss sort of the risk factors for individuals who have intellectual and developmental disabilities. So a lot of the same risk factors that I listed on the previous slide for type 2 diabetes impact individuals with disabilities as well. One risk factor that I didn't list out, but it is something to think about, is healthcare management. And so some individuals with disabilities may not necessarily get the same health equity as somebody without a disability. And if we aren't regularly going in for primary care checkups and or getting education on how to help us with our health, right, to keep us at our healthiest stage in life, then we are at a risk for developing chronic illnesses like high blood pressure or diabetes. Also, another important factor for individuals with IDD who might be taking certain behavior modifying medications, some of those medications do play a role in developing what we call metabolic syndromes. And those are things like altered lipid levels. So that's going to be when your doctor is measuring your triglycerides and your LDL cholesterol. That's one type of metabolic disruption. Diabetes is another one. And so sometimes the medications we take, though they're beneficial and necessary for the management of our overall health, they may increase the risk for other diseases, like I said, diabetes being one of them. Alternatively, other potential challenges, again, we listed them on the last slide, but physical activity and body composition do play a role in that. For some folks with disabilities, genetic alterations that are kind of a component of that disability sometimes can make it difficult to maintain a body composition that has more muscle mass, right? Some genetic variations cause what we call low muscle tone, and that can be difficult to then sort of keep a body composition that might be beneficial to avoid diabetes. So certain elements of that individual having a certain diagnosis might put them more at risk for diabetes than somebody else.
So in addition to the physical health different challenges that come with diabetes, it can also lead to a lot of mental health challenges that people with diabetes face. It can be very overwhelming and make you more likely to experience different mental health conditions like anxiety, burnout, and depression. When diabetics are going throughout their daily lives, they have a lot of daily management they have to pay attention to, and the number of decisions they have to make from day to day it can be overwhelming for a lot of people. And so all those decisions make life a little bit more stressful than normal. And it can also impact people's relationship with food. So as Kate mentioned, when, thinking about blood sugar, taking insulin, the food that you eat impacts the level of your blood sugar. So from my perspective as a diabetic and from other diabetics' perspectives, the relationship with food can change, and people can sometimes see it more as a medicine, and maintaining that healthy relationship with food is very important for diabetics. This can also impact daily activities with all those decisions that diabetics have to make. Things like focusing on work or participating in physical activity can be more challenging because you have to take those blood sugar numbers and everything into account. It can also disrupt sleep for a lot of people if you have blood sugar challenges at night, and just the increased challenge of as I mentioned, the anxiety and depression, how that affects sleep can also be a challenge. A lot of diabetics experience isolation and loneliness. People with different chronic conditions in general, I mean, it's not something that everybody goes through. So when I was first diagnosed, I felt different from a lot of people. So that isolation and loneliness can definitely be there, and why it's important, as we'll talk about in a little bit, to have some good social support. And there's a lot of community resources for diabetics and different community gatherings that diabetics go to, and so they can talk with one another and share their experiences. And also grief is a big thing that a lot of diabetics feel. With grief, that's typically something people associate with somebody passing away, but it's grief is it's a loss of a potential future. So it's, if you're diagnosed with diabetes, it's, your life might look different from that point on, and you have to perceive your life a little bit differently than what you expected it would be. And then poor diabetes management can also make those mental health struggles a bit worse and more stressful, and then that stress can impact diabetes management as well, make it a little bit more challenging. And then with those challenges that people face, that's why it's so important to weigh all these different impacts of daily decisions on your health and on, if you're diabetic, on your diabetes. And there's a lot of different ways that people manage their diabetes. There's no right or wrong way. It just differs from person to person. And Kate can talk a little bit more about the nutrition and medical side of it. I'll just say that from what I've seen in my own diabetes and other people I know who have diabetes, managing physical activity and sleep, having that social support, like I mentioned, whether that's family, friends, a counselor, your medical team, or a group of other diabetics, which I'll talk more about. And then there's different medications people take, and again, it varies from person to person. But is there anything that you wanted to add to that, Kate?
Yeah, I'll just kind of touch base on like the medical side, like you said. I think a big part of diabetic management is working with your medical team to share kind of where you're at. They're going to, of course, be monitoring your blood sugar, and that's something you're going to do at home and bring those records in and talk with them. But I think also kind of speaking to the emotional side as well as the dietary and medication side, and letting your healthcare providers know what's working for you or what's a challenge for you. is something I always suggest to every person. Sometimes I think being a dietitian, one I feel like myth I've run into with clients is they want to sometimes be kind of that ideal client, right? They sort of, I don't know if people strive to get an A or, want to make sure they're doing everything right. But the thing I encourage folks to do most is be honest with your healthcare providers about what you're actually able to do and what you want to do, because then they can work with you to find the best medication regimen or the best dietary regimen that really meets your personal needs and what your lifestyle is, because not everybody's the same, and you don't have to just follow a standardized plan of care. The other thing I'll encourage everyone to sort of take advantage of is the use of diabetic educators. You'll oftentimes have access to them through your endocrinologist or your physician that you're seeing for diabetic management. A diabetic educator is typically either a nurse or a registered dietitian who has additional training and specialty in diabetes management. And they can really spend some time to craft your care plan to meet your lifestyle, whether that's dietary management and kind of finding what are those foods that you actually like to eat and how do we make those work, alongside your medication, as well as helping with physical activity and sleep management, because those are very, very important. Physical activity can help with high blood sugar, but it also can help us manage stress, and it really does play into our sleep cycle as well. When we have a good physical activity regimen, it can definitely help be a part of what we call sleep hygiene, right? And those are sort of the things that we do to help us sleep and maintain a good sleep schedule. All the other items here, like around medicine and insulin, those are all different things that are going to be different for each person. And again, you're going to work with your care provider on those different things. And like I always say, advocate for yourself, be really strong, and let people know again what's working for you, or what isn't working, so they can find the best management program that you're going to be successful with.
Thank you for adding that, Kate. And as I mentioned a couple times before, those community resources are really important. Since this is going to be a YouTube video, you won't be able to click on the links. But if you're interested in any of these community resources, let us know. We can get those links to you. These are just a few that I've had some experiences, like good experiences with. The American Diabetes Association, or ADA, they have a lot of educational and support resources for people with diabetes. They even have things like bike races, walks, different community activities to kind of bring support for people with diabetes. And then beyond type 1 and beyond type 2, those are part of the umbrella organization called, I think, just called Beyond. And they're not very well known, but they are a great community resource for people with diabetes, and that they almost create like a social platform for people with diabetes. There are apps you get on your phone that are almost community building, social media resources, just to help people feel a little bit less alone in their diabetes management. They also provide different community programs similar to the ADA, diabetes education, and they have plenty of mental health resources too, whether that's access to counselors who specialize in working with people with chronic conditions, or support groups in your area. They have a lot of things like that that are separated by your region. So you can search within your area which counselors and support groups might be best for you. And then very similarly to the ADA, the JDRF, or Juvenile Diabetes Research Foundation, they have a lot of those education and community building resources as well. And then diabetes technology, that was one of those pieces that people can often use to manage their diabetes. And again, it looks different for everybody, so not everyone will use technology. But there are things from insulin pumps to that give you insulin throughout the day. And then there's also blood sugar sensors that read your blood sugar at regular intervals. And some people use them, some people do not. But what I've seen from people who do use them is they can help people more closely manage their diabetes from day to day and even minute to minute with updates, coming regularly to their devices. And they can also decrease that toll of daily decision making and stressors that comes up. And then it can really help people see how we want our lives to look and take charge of that. And I was very scared to switch to insulin pump when I first started online. Having that technology take some of that burden away from you, it's a huge responsibility to depend on the technology. So even though it can create fears for a lot of people, and that is really common, it can also help people find a little bit more freedom in their management and in their daily activities as well, which is really nice. And then again, kind of like Kate mentioned, if you need support, definitely contact your endocrinology team. It can be physicians, diabetes educators. And then if you have any questions about needing support living with diabetes, you need any help finding community resources, I can definitely help you find those. And we provided an email here, handout request at slark.org, that you can reach out to with any questions or concerns.
And we did just get 3 questions come in. Yeah, so the first one is the child more at risk if their mother had gestational diabetes?
So I can take this one. According to the ADA, there is an increased risk for the child, not necessarily developing type 1 diabetes. It's more of a risk that later in their life they may have a predisposition to type 2. However, if the mom or the individual who is pregnant with the child, if they're getting counseling and they're working with their physician to control that gestational diabetes, that risk kind of decreases. The biggest part is that when gestational diabetes is in play, oftentimes the baby is sort of exposed and accessing more energy than it typically, baby typically would in the womb, and therefore the baby's pancreas starts working a little bit earlier and starts pumping out more insulin than it would typically expect. So you do see an increased risk later in life for type 2. But like I said, oftentimes OBGYNs are working with their patients to help manage that diabetes, and those individuals who are pregnant should likely do what's called a glucose tolerance test fairly kind of in the middle or so of their pregnancy to identify if gestational diabetes is present.
Right, and our next one is, what are support groups for diabetes like? What can I expect?
Well, they're all very different. I was in one that it was called the College Diabetes Network, and what I got from it was a sense of not feeling like you're alone in that condition. Sometimes people, give their own stories about diabetes and what they've experienced, enjoying snacks together, just doing activities, going to museums. I mean, it's very, I think, focused on that community aspect and just knowing you're not alone. From my experience, there's not a whole lot of focus on, talking about a lot of those deeper emotions that come up with the stress of diabetes. I think that those more emotional support groups would definitely focus on that, on your experiences of the stress of diabetes. But the community resources are very, I would say they're more focused on that community building friendships, and helping you feel a little bit less alone and isolated.
And then, do you find that people with IDD use or don't use tech to monitor their blood sugar? Is that easier for staff to support them if they can access their numbers at any time through tech, or their family could have access to those numbers remotely?
I would say that it kind of depends on the person. Oftentimes, individuals with type 1 are going to be the folks who you see using technology more frequently to sort of support them with blood sugar monitoring as well as insulin administration. In terms of the population that I've worked with, most of the folks I work with have type 2 diabetes, and so they don't typically have insulin pumps or they don't usually use tech to monitor their blood sugar. They're just doing your typical glucometer finger stick traditional version. But I can really see the benefit that technology is going to offer to individuals with IDD. Even those who maybe aren't just type 1 folks, right? I sort of see it as being a tool that, decreases the amount of, I sort of always say intrusiveness, not in a negative way, right? But our staff, staff are providing a variety of supports and, doing a glucometer is sort of intrusive versus an individual being able to sort of kind of live their life and go about their day and be able to use technology to remotely monitor that blood sugar. So I haven't seen it used frequently. However, I think the technology itself is just kind of new within the population. So I think we're going to start seeing it used more frequently to the benefit of those we support, because I really think it's going to offer independence in a new way that we haven't really seen before.
Do you all have support groups for people with IDD and disabilities? Yeah.
Okay.
We do not. We have a lot of variety of support groups, though, that this could also be talked about. We could also try to make a support group like that if that would be of interest for quite a few people. So thank you for asking that. And then our last one, can you start as type 1, then become type 2 as you age, or are you always the type that you were originally diagnosed as?
That's a good question. So type 1 you're never going to really shift from a type 1 to a type 2, right? Like, and you're never really going to shift types. That's you can just sort of say that we're not really going to shift types. Type 1 individuals, typically what that means is their pancreas, again, an organ in our body that produces insulin. The cells that typically would produce insulin do not produce insulin. They're not functioning correctly. And therefore, if you have type 1, you're going to be using insulin via an injection or a pump pretty much immediately. Whereas type 2 individuals, that's typically where you see, again, that's going to be something that kind of takes some time to develop. It might be that you end up taking just oral medications to help manage your blood sugar. Some individuals with type 2 may eventually require insulin, but we're not going to all of a sudden say, oh, well, they're now a type 1, because it's really not about whether or not you require insulin. It's how the diabetes developed or occurred. And so even if you're type 2 and you use insulin, you still have type 2 diabetes. Now, I didn't really talk about this earlier, but there is sort of this new, quote unquote, new version of diabetes that we're starting to see in the clinical setting, and they're kind of naming it type 1.5 or type 3. It doesn't really have an official name, but it's another autoimmune disease. And what it ends up looking like, it looks very similar to type 1. However, it's developing in individuals who are typically over the age of 30, and it's kind of being driven by an immune response. And there's not a lot of information about it, but those individuals typically also require insulin immediately. So you're not going to switch types. You're just going to kind of be the type that you are or how it developed. And then it's going to be more then about your care plan and what medications you use to help monitor and control your blood sugar.